Hi, I'm Dr. Jay Heinz with Houston Injury Solutions Network, and today I'm here with Dr. TJ Jones of the Spine Institute of Southeast Texas, and Dr. Jones is an orthopedic spine surgeon. One of the questions that my patients ask me, Dr. Jones, is how do they know when surgery is their only option?
Well, that's a great question. A lot of times patients come into our office thinking that, you're coming to see a surgeon, you have to have surgery. That's not particularly the case. In most circumstances, the majority of people who come to my office don't need surgery. And so only about 10% of the patients actually come into our office actually end up winding up having surgery. The only times when surgery is absolutely mandatory is if you have a progressive neurologic deficit, if you have an issue with your bowel or your bladder. Those are the things that we really want to hone in on and make certain that those patients get appropriate care in a very timely fashion. The other things that are really important are people who have intractable pain. If we've tried everything we can to try and get them better without surgery, we've tried medications, we've tried injections, we've tried chiropractic care, therapy, and those things are not working for them and they don't like the way they feel and they are not able to carry out the activities of daily living, that's when surgery is appropriate for those patients.
So that helps a lot. One of the things that patients may not quite understand is what is progressive neurological deficit?
Okay, that's a great question as well. So usually when we talk about neurologic deficits, although I'm a back surgeon, a neck and back surgeon, usually neurologic deficits will affect the arms and the legs. Also, they'll affect the bowel and the bladder. So a neurologic deficit, for example, could be weakness in the arm or leg. It can be pain in the leg or arm, but usually we're talking about weakness. And so if someone comes in and they have full strength, that means they have 5 out of 5 strength. But if they are not able to lift their hand against gravity, then you start talking about, you're going down into like a 3 out of 5 out of strength and things like that. And so when you have a progressive loss, progressive weakness, if you have progressive numbness and tingling that's getting worse or starting to spread to other areas, that's what we're talking about when we mean progressive neurologic deficits.
So initially, if they've got some motor loss, so say if they're trying to lift their biceps and it can do this, but it doesn't resist quite away. Is that progressive, or is that just some motor loss that might respond to conservative care?
If you have some motor loss, I'd say, anywhere from about 0% motor loss to about 20% motor loss, that's when we're talking about, things that can definitely be treated sometimes with conservative care. And I would definitely encourage that for most patients because a lot of times, with the right activities and the right exercises, those things can improve. And so it's very important that we give those things a shot. But if someone comes in and they're not able to walk, for example, that's bad. They need to be evaluated immediately.
Okay, thank you.
Absolutely.